Right, welcome to our channel today, everyone. We're going to talk today a little bit about scars and in respect to gynecomastia or male chest surgery. Obviously, scars are one of those sort of perennial issues with everyone whenever they're undergoing any surgery. Everybody's always worried about scars because, let's face it, nobody really wants to have a permanent mark left on their body. And if they are going to have one, they like to know exactly where it's going to be, how big it's going to be, and what it's going to look like. And of course, these are normal questions that everybody asks when they're coming towards any kind of surgery. The thing is, of course, as a surgeon, any sort of decent surgeon worth their salt is not able to guarantee somebody's scars. All we can do is explain to the patients where we're going to be putting these scars, and from our experience in general, what these scars normally look like. And I say normally because, sure, 95%, 98% of people will fall in within a certain category of scar healing. But there's always going to be, a small fraction, 1%, 2%, who perhaps, heal unfavorably. And that's something that's not in our control. Unfortunately, it's not in the patient's control either. But there are things that we can do these days which will help to modify the scar's response and try to optimize its healing. But at the end of the day, you know what? It's actually time that's the great healer. And you give any scar some time. And when I say time, I'm talking about many months or even up to 2 or 3 years. Scars normally become quite soft and inconspicuous. Now, going back to gynecomastia surgery, I suppose a little bit of history is probably relevant here because when surgeons started doing male chest, which was actually over 100 years ago, the classic incision was right around the areola or the nipple. And it was really quite extensive because they needed to have access to the area behind the nipple where the gland was and where that bulk of tissue was. And they also had other issues they had to contend with bleeding. They couldn't sort of stop the bleeding as we do now, of course. And so they had to have good access, so the scars had to be much bigger. And obviously stitching techniques weren't that good back then, so the scars weren't always brilliant. Moreover, some surgeons actually extended beyond the nipple and went far across the skin and the chest as well, so leading to some awful scarring. Thankfully, those days are gone, and nowadays we can concentrate on tiny, tiny, small little incisions, almost keyhole incisions, because our knowledge has developed, has changed, and our understandings have changed. So because gynecomastia surgery involves the removal of two elements, okay? Two elements meaning there's excess fat and excess gland behind the chest, you have to deal with them with two separate ways. One way to deal with the fat is to do some liposuction. And I'm sure a lot of us know about liposuction. They've heard about liposuction. It's done through these sort of long straw-like tubes that we insert underneath the skin and effectively, suck out the fat. Now, because these tubes are very, very, very small, the incisions or cuts that we require to get them into the chest are very, very small as well. In fact, they're only about 3 or 4 millimeters. So we're talking about very, very tiny incisions. And these are usually placed right underneath the armpit in an area where you really don't see anyways regularly. You wouldn't spot it. So that deals with the fatty component, okay? Once we've cleared away the fat, that then leaves the gland for us to remove. And that's much more readily visible once you remove the surrounding fat. It becomes much more clear. And because the gland is situated right behind the nipple, we have to make an incision directly overlying that. So as the nipple is sitting there, we basically make an incision at 6 o'clock, right at the bottom. And it's usually a small stab incision, which is probably maybe the order of about 7 or 8 mils, or under 1 centimeter. People kind of question, how are you able to remove a gland that is many times quite big? And in fact, it could be quite easily the size of a large chestnut, okay? How do you remove something like that through a small incision? Well, I suppose the answer to that would be that if we needed to remove that whole gland in one piece, then of course I would need to have a very large incision to get it out. But for every patient that comes in, they don't care if the gland comes out in one piece or 20 pieces. So with that in mind, what we do is we actually cut it up before we take it out. So we take it out in pieces. And because we take it in small pieces at a time, I'm able to use small little incisions. And so that's why the incisions are very small. And because the actual incisions are quite small, in fact, they don't require any stitches. Because people automatically ask me, well, why aren't we putting any stitches in it? Well, the reason we don't put stitches in it is this. Any incision which is really quite small actually has the capacity to close up on its own. Let me put it this way. If you were to cut yourself at home and had a tiny little cut that big at home, say you cut yourself with a knife or a can, would you run to the doctor? Probably not, right? You probably just put a little plaster on it and it heals over. Well, exactly the same logic applies here. Okay, so you don't need to put stitches in, and the vast majority of the time, the scars heal up very, very well indeed. But the thing is this, every scar will take time, and ultimately you're looking at about 9 to 12 months before it, what we call matures, or becomes sort of very faint and soft. And you know, we've got lots of pictures to show you in terms of what scars can look like, and they really are pretty imperceptible the vast majority of the time. Very occasionally you get a person who's got a lumpy scar, which despite time, despite sort of massaging it and helping it along, it actually doesn't become flat. It becomes raised and very noticeable. Well, in those situations, we do have at our disposal things that we can offer patients which will help to shrink a scar. And that usually involves a series of injections, cortisone injections. Now, we know cortisone can shrink tissue quite nicely. And we do have those reserved for patients where we find that the scar doesn't actually shrink the way we want it to. To be honest with you, it's something I usually utilize once every 2 years on patients. So it's not something we need to do a lot of. But in those situations where we have a need, because the scar is just unsightly, it's not settling, we give it enough time, then cortisone injections can work to shrink the scar. By and large, the bottom line is this. You know, I want people the takeaway message is, if you're going to be having this type of surgery, you need to understand that scarring, sure, it's a concern, an issue for everybody, but from experience, and the reality is that very, very few patients actually have problems with these scars, and in fact, quite easily can take off their top, and you know, I doubt the vast majority of the public would ever be able to see where these scars were. So that's always reassuring for patients to know.